Hey, it's Megan.
And Hunter.
And welcome to our TED Talk
called Phobia Fanatics,
where we're going to talk about certain phobias and how they affect our personality.
Fears and phobias are not the same. A phobia is similar to a fear, but with one key difference. The difference is that fear is the emotional response to a real or perceived threat, while a phobia is the anxiety the individual experiences is so strong that it interferes with their quality of life and or their ability to function.
Around the world, 3% to 15% of individuals have been diagnosed with specific phobias. We all have fears, but phobias tend to be viewed as unreasonable or excessive compared to standard fears. Main causes of phobias are past incidences and traumas where certain situations might have a lasting effect on a person's life. Another cause could be learned responses from early life, like factors from a person's childhood environment.
Not only environmental, but also genetic factors can cause phobias. Children who have a close relative with an anxiety disorder are at risk of developing a phobia.
Let's just get over with. So for our first phobia we're going to talk about is arachnophobia, which is fear of spiders. It is the number one most common animal phobia in the world, affecting 3.5 to 6.1% of the global population. The name phobia technically means extreme or irrational fear of spiders. It is more common in women than it is in men, and one of the causes of it is conditioning views, which is reacting to other people's reactions. Psychologists believe that one reason why people fear spiders is because some direct experience with the erratics installed that fear is in them as well.
Next is fear of small spaces. Claustrophobia can make people feel very uncomfortable and anxious in confined spaces. When the anxiety grows, panic attacks also may occur. Panic attacks can be very frightening, and they may be so intense that a person might try to avoid situations where an attack might happen. When one fears their own phobia, it significantly disrupts their life. Tips for managing this phobia include breathing slowly and deeply while counting to 3 with each breath, focusing on something safe, reminding yourself repeatedly that your fear and anxiety will pass, and challenging what's triggering your attack by repeating that the fear is irrational.
Next phobia I'm going to talk about is spectrophobia. Spectrophobia is a fear of mirrors or specters. This fear may not be of the mirrors themselves, but what they represent and reflect. Many times, this fear can be tied to religious beliefs or superstitions. Some studies suggest that there may be a genetic factor. The gene will not dictate the phobia that the person will have. However, this gene may make a person more susceptible to phobias. People with spectrophobia may avoid mirrors and anything that reflects at all costs. They will not use anything that is made of glass. When they find themselves in a room with a mirror, they will experience all the symptoms of anxiety. For examples, they will have increased heart rate and blood pressure. Many feel dizzy or nauseous. Also, many will have an instinct to flee. Main treatment plan for spectrophobia is therapy. Sometimes they will be prescribed medications to lower the anxiety, and they also can have exposure therapy as well to deal with their phobia. So which ones are we done with?
Even seeing their loved ones suffer can lead to a lifetime of fear of pain. Children who have experienced pain at the doctor's or dentist's office will be fearful of experiencing that pain all the time. The condition can be debilitating and disruptive for everyday life, as the individual constantly thinks about pain, and as a result, the condition turns into a vicious cycle that aggravates their mental and physical distress. Algophobia can be treated with behavioral therapy and anti-anxiety medication.
Next, I'm going to be talking about germophobia. In this case, germs refers broadly to any microorganism that causes diseases. For instance, bacteria, viruses, or parasites. The emotional and psychological symptoms include intense fear or terror of germs, anxiety, worries, or nervousness related to exposure to germs, thoughts of being overcome with fear when germs are present, avoiding or leaving situations perceived to result in germ exposure, rapid heartbeat, sweating or chills, shortness of breath, tingling, headache, restlessness, and difficulty relaxing. This much anxiety leads to compulsive behaviors, including frequently washing their hands, showering, or wiping surfaces clean. Causes of germophobia is negative childhood experiences, family history, environmental, and brain factors as well. Treatment for germophobia includes therapy, medication, self-help, which is like just getting yourself used to like knowing that there's germs around, or staying active can help as well. Oh, I have popsicle too.
Fear of failure. In general, a person may be more likely to develop atychiphobia if they have past experiences where they failed, especially if the experiences were traumatic or had important consequences. If someone has this phobia, they have an irrational and persistent fear of failing. Fear of failure may be part of another mood disorder, anxiety disorder, or eating disorder. Perfectionists may also deal with atychiphobia. This phobia affects personality in a way that if the person fails, they feel totally demoralized, helpless, hopeless, and anxious.
While the individual is afraid of fear, they actually also tend to expect it. This phobia may also influence students' motivation to learn and negatively affect their attitude to learning. Ways to face the fear of failure, including redefining failure, setting approach goals rather than avoidance goals, creating a fear list, and focusing on learning. Treatment options may also help, such as psychotherapy, medication, or lifestyle changes. Some phobias can lead people to avoid social situations. Many people become embarrassed from their phobias, so they start excluding themselves from people and activities.
With that, not only are they left alone, but now they have time to wonder why they can't be like everyone else. Now for the last phobia. Hippopotamonstrosis quipedalophobia, which is the fear of long words.
Ironic, isn't it?